is your typical week look like? What do you do? It's 7 days in a week. So out of those 7 days, how many times a week do you go out and do something besides doctor's appointments?
I go out maybe 4 times a week.
You go out 4 times a week, so
Yeah.
3 times a week you're home doing nothing.
Yeah.
What do you do at home?
Sometimes I'll do laundry or I'll watch TV.
You just watch TV. Why do you watch TV?
Because it soothes my anxiety about chronic pain.
Okay. And what happens if there's something in a show that you're watching, like a car accident or somebody that's like you and has chronic pain? What does that do?
I turn something else on.
Okay. Okay. So when you do go out, what are you doing?
Sometimes I'll go to the store real quick.
Okay. But we just discussed earlier that you can't go to the store by yourself,
Yeah.
so somebody goes with you?
Yes.
Okay. Okay. And then are you doing anything like fun, like putt-putt, or I don't know what kids do these days, but
I go to the movies sometimes, but sometimes I'll just not sit in the chair. Sometimes I'll bring a lawn chair with me and I'll sit in that.
okay.
That way I'm away from everyone.
So it's really right now we're more about our anxiety towards people, not so much the fact that you have chronic pain,
Yeah.
but just the fact that you don't want anybody to know.
Yes.
So we need to somehow come up with a way for you to maybe be a little bit more in a group setting and get to know different people and realize that people are not always after you.
Yeah.
So how do you think we could do that?
Maybe confronting someone, maybe like a stranger or something, and just see if just ask them, do you ever see me, or would you ever think of me being or having a chronic pain, or do you think my anxiety, can you see that I have anxiety or whatever? But I don't really know what I could do.
But we're gonna talk to a stranger, which I don't
Yeah.
think would help you so much as hinder you. So what if you went to a place where you had your group of friends and they brought some other friends that you didn't really know?
Yeah.
Maybe talk to them and see, and maybe that will help with your anxiety towards people.
I think so.
Do you think that would be better for you?
Yeah.
Okay. So I think we've dealt with your negative thoughts. We know that you have chronic pain, but that's not really your issue in the sense it's more of your anxiety and how people judge you. Is that
Yes.
okay? And then you came to therapy when we first met. You came to therapy and you wanted to get over your chronic pain and the thoughts in your head, and just constantly sleeping because it's it's too much to get up.
Mm-hmm.
But now we're at a point to where we're learning that, okay, McKenna doesn't like people. She doesn't like people judging her.
Yeah.
She doesn't so we're not even in the chronic pain issue anymore.
No, I just don't want people to judge me, if I were to tell them my story or something.
Mm-hmm.
I don't know. I just kind of get nervous about it.
Okay. Have you ever been to a group therapy setting
No.
for chronic pain?
Mm-mm.
How do you think you would do in that?
I think it would be good, just because that way I can see that other people go through it too, so then, I won't be more, hesitant towards other people when I'm around them. So I think the group setting type counseling would work, yes.
Okay, so why don't we maybe look into that? We're not going to do that this week. This week we're really going to focus on maybe you getting a little bit more out of your shell, kind of learning a little bit more that people are not all bad, and that your life is not, every single time you go out, it's not like, oh, someone's judging me, someone's judging me. We need to get you there first, I
Yeah.
think, before we can get you anywhere else. So,
Okay.
we're going to do art therapy, I think, would be best. So,
Okay.
you have a close friend. What's his or her name?
Her name's Stephanie.
Stephanie?
Mhm.
Okay. And you think that, and she knows everything. She knows your chronic pain, she knows
Yes.
your anxiety, she knows your tics, she knows.
Yes.
Okay, so you're going to take her to your art class.
Mm-hmm.
And then you're going to come back and report to me and let me know how it is next week.
Okay.
But first, I want us to see, how are you feeling right now?
Fine.
You're okay.
Yeah.
Anxiety wise, you're good.
Yeah, it's gone down a little bit since I've been talking to you. So yes.
Okay. So are you enjoying our
Mhm.
sessions together? Is it helping?
Yes, it is.
Okay. So how are you feeling today with the chronic pain? How's that?
I mean, it still hurts. My back has
Mhm.
been bothering me all day, but I just try not to think about it.
Okay. And I think you're gonna do better with the pain and things when you do start to go out and you start to have your friends, help you get your mind off of it and all that stuff. So I think we just need to make a step towards getting you out more.
Okay.
And maybe you can sit down and go and figure out what is worst case scenario. Actually, let's talk about that now. What is worst case scenario when you go out? Worst case scenario is somebody comes up to you and does something, like, what would you see? What would you tell me, like, okay, Jen, I went out, absolute worst thing in the whole entire world happened to me when I was out. What would that be?
Maybe either my pain increasing
Mm-hmm.
or maybe someone's trying to play a trick on me.
Okay, so that's not too bad.
Mhm.
If let's say it was your pain,
Yeah.
what would you do?
I would leave as soon as possible and go back home.
And what do you think that the friends that you're out with, what do you think would happen?
I think that they would understand because they know exactly what I've been through.
Okay, and what about their friends that you haven't met before?
They probably wouldn't know.
They wouldn't know why you're leaving.
Yeah.
What do you think they would think about you?
They would probably think that she doesn't like us anymore and that I'm leaving because I don't want to be around her.
So what is a good way for you to maybe talk to those people before you leave and say, I'm leaving, without telling them about the chronic pain and anxiety? How would you tell them that? I'm leaving, it's nothing against you, but how would you say that?
I would just gently tell them that, my stomach hurts and I need to go home.
Do you think that's a good enough excuse?
Yes.
Okay. Alright, so just to go over everything today, pretty much we came to the conclusion that your anxiety outweighs your chronic pain.
Mm-hmm.
That we're going to go to an art class this week
Yeah.
with a friend, not by ourselves,
Mm-hmm.
and we're going to see how that goes. And then next week we're going to come back, you're going to let me know how it went,
Mm-hmm.
and we're going to see if we can maybe get you out a little bit more during the week, but we're not going to do everything to where it's going to overwhelm you. We're going to do a little bit. If you come back next week and you're like, you know what, that art class was too much,
Mhm.
then hey, we'll think of something else
Okay.
and we'll bring it into play and we'll work slowly. I want to go off of how you feel and your daily things. I don't want you to think, oh, I have to do it because she's telling me I have to do it.
Yeah.
I want you to be comfortable. So always make sure that you're telling me what's going on, how you're feeling,
Okay.
what happened.
Okay.
Okay?
Okay.
All right. Well,
All
good luck.
Thank you.
All right.
All
Bye.
right. Bye.
I feel like we're on the phone.